Hi, this is Pamela Worth with the Moms Empowered podcast and Hello Health. And today I have Dr. Keith Ellis, who's a scientist and associate professor of medicinal chemistry, using his knowledge and expertise in medicinal chemistry, pharmacology, and natural products to research the biological mechanisms that cause long COVID and create custom formulated over the counter solutions for long COVID that are safe, inexpensive, and accessible for everyone. Thank you so much for being here, Doctor.
Oh, thank you for having me.
So tell us a little bit about your work and kind of some of the common questions that people ask you when you first are working with them.
Sure. Long COVID is an area that I started kind of working in around 2023 and early 2023. And it started out as one of those things where I did what I would normally do as an academic and a professor and a scientist. And then it took a very different turn and went to a very different place. My day job, if you will, is I'm an associate professor. I'm a medicinal chemist. Medicinal chemistry is the subdiscipline of chemistry that really specializes in discovering and developing new drugs. My degrees are in organic chemistry, and then I shifted over into medicinal chemistry as a postdoc, and that's what my faculty position has been. And I've spent most of my career doing what I think of as early stage lead discovery, mainly in oncology, a little bit also in antibacterials when I was first starting out, but mainly in oncology. So the type of problems that interest me are kind of where um, biology and mechanisms in the body meet with small molecule drugs and trying to design and optimize therapeutics to actually kind of help make people feel better, right? Those are the kinds of problems that interest me. And I started getting into long COVID thinking I was going to do a normal academic project for my lab. And that's kind of the way I approached it. I went to the COVID and the long COVID literature in early 2023 and said, well, okay, you know, COVID's been around for a couple of years now. We know enough about it. We seem to have a pretty good handle on acute COVID infections by that point. But there was this new condition of long COVID that seemed to be affecting more and more people and was a significant problem. And there didn't seem to be a lot of solutions for it. So I wanted to kind of learn more about that with the thought of trying to do a normal kind of academic project in my lab to start the process of trying to discover and develop new therapeutics. Because most people don't know this, but when we have a kind of a new disease we start working on, it can take 10 to 15 years to really discover and develop a new drug. From the time that you really start that process of discovery through the time when it's available for a physician to write you a script and go to the pharmacy and pick it up. It's a long process. And even though long COVID had not been around for that long in 2023, I decided, well, people are still sick and they're not getting any better, and let's get started on that process. So that's where I started with things, but again, they took kind of a different turn for me.
So, what are some of the common symptoms that you hear about from people?
So when you look at symptoms for long COVID, they are distinct from an acute COVID infection, right? So by now, most people have had COVID, right? An acute COVID infection comes with the super high fever, which most people experience, the fatigue, the lethargy, the really sick, I can't get out of bed kind of you're not sure whether you have a cold or the flu, and then you get really bad and you're like, oh, I might have COVID, right? That's kind of the way acute COVID infections go. Long COVID is this distinct condition where people get an acute COVID infection and then they recover for the most part. And not everybody, most people that get long COVID don't completely recover from that initial acute COVID infection. They get maybe 80% of the way better. They still have a lingering cough. They maybe still have some lingering fatigue. So it's like they get mostly better and then they kind of plateau. And then long COVID is technically defined as illness that persists 3 to 6 months past that initial acute COVID infection. And with typical people that get long COVID, in that 3 to 6 month window, not only will they have these symptoms that persist, but then they start acquiring new symptoms and they get sicker, and they get sick in kind of a new way with new symptoms. And the way that I've come to think about the symptoms for long COVID is you've got core symptoms that everybody seems to get, and then you've got this larger constellation of symptoms where some people get some of them and others will get different ones, and it's what makes long COVID kind of very difficult to deal with, number one. And then number two, it makes every case not look quite the same, so it makes it more difficult to handle. So the core symptoms for long COVID are really fatigue, brain fog, and then typically there's some kind of cardiac type symptoms like a shortness of breath or issues with your heart rate regulation, right? Those are kind of the core symptoms. Everyone that gets long COVID seems to have those three symptoms. And then beyond that, again, there's this larger constellation of there's a set of kind of more severe cardiac symptoms, full on tachycardia or what's called POTS, where you're not able to really control your heart rate, especially when you get up and you're moving. Extreme shortness of breath, even doing like moderate activity or just walking upstairs. So there's a whole set of cardiac symptoms. There's a lot of involvement of inflammation, because long COVID causes inflammation in the lining of the blood vessels. There's usually an immune response component that a lot of people see, and then there's more severe what I think of as neurological type symptoms. So most people have the brain fog, that lack of mental clarity, but then you can also have other neurological symptoms like headaches, anxiety, depression, and then a lot of people will also sometimes have a GI component, what people call gut dysbiosis or leaky gut, right? And they'll have GI involvement as well. And again, so all when you look at all those symptoms, you're crossing multiple systems in the body, right? And that's why I think of it as this larger constellation, because some people have gut dysbiosis, some people don't. Some people get the headaches or the anxiety or the depression. Some people don't. But again, these core symptoms for the long COVID seem to be fatigue, brain fog, and then some kind of shortness of breath, cardiac irregularity that people suffer from, that is, again, either more mild or more severe depending on person's case of long COVID.
So, the way we typically treat things is by attacking each symptom, but maybe there's a better way to attack the inflammation and kind of the guts of this. So, what do you suggest for
Mhm.
people to do or to test for or to think about?
So when I went into the literature, it was with the kind of modern scientific point of view of let's go find a drug target, right? And drug targets are linked to mechanisms. Mechanisms are very much linked to systems in the body. It's the way we practice modern medicine. And when I went into the literature, I was actually kind of shocked and disappointed because I didn't find a lot of the advanced kind of what I think of as pathophysiological data, mechanistic data about the disease and how it works and how it's impacting the systems of the body. So I didn't really find a good starting point for an academic project, which was really disappointing. And again, it was both shocking because I knew a lot of money and time and energy and publications were coming out on long COVID. But it also kind of made me mad because it's like, well, we can't focus on this enough to really figure out what we have to do. So I went back to the literature with asking a kind of a different question. I said, well, what do we know enough about to actually really help people right now? And that ties into the inflammation question. So one of the really good hypotheses that has been well developed in terms of causative mechanisms for long COVID is what's called the microclots hypothesis. And the microclots hypothesis is this hypothesis that COVID spike protein actually interacts with proteins in the circulatory system, soluble ones that are typically used to form clots. But when the spike protein interacts with these clotting proteins, it causes them to change conformation and misfold. And those misfolded clotting proteins form into what we call microclots that are kind of these amorphous, unnatural, irregular amalgamations of this clotting protein that the technical scientific term for is amyloids of this particular clotting protein. So there's these abnormal, unnatural microclots. And when you dive into literature and really look at microclot hypothesis, it's one of the few mechanisms that ties in and starts explaining almost all these symptoms that cross all the systems in the body, because microclots can account for the fatigue, they can account for the brain fog, they can account for the shortness of breath and the cardiac symptoms. Microclots have been shown to cause inflammation in the lining of the circulatory system and touching off all kinds of inflammation responses and cascades. They're also immunogenic, right? They're an unnatural protein formation in the body, so they can have an antibody response to them, including the formation of autoantibodies, which kicks off the immune system component that a lot of people see in long COVID. Basically, microclots can explain a large number of the symptoms that you see in long COVID. And that also gives us then an opportunity to have a mechanism that we can start looking at to try and help people recover from long COVID.
So, how would you over the counter take a look at microclotting?
Um, so if you want to actually look at microclotting in the blood of long COVID patients, it's actually unfortunately not the easiest thing to do. There is no clinical laboratory assay for it. So if you go to your primary care physician and say, hey, I think I have long COVID, I think I have microclots, I want a microclot lab test, they're going to look at you and say, yeah, we don't have that. It's just not a technology that exists yet. They're working on it. There is a laboratory assay that can be run, but it's a manual assay. It uses a fluorescent microscope. It uses fluorescent dyes. So it's something that can be done in a research setting. I think they're working on commercializing it into a clinical test, but that kind of thing takes some time and takes some doing, particularly automating it and making sure that it's robust enough for clinical use. So if people today really wanted to know if they have microclots, there are some of these private pay long COVID clinics around the country, and you can go to them and you can get microclot testing there. The unfortunate part is it's really expensive, and usually you have to pay for it out of pocket. Insurance is not going to cover it. So that's really the only definitive way at this point to really understand whether somebody has microclots is to do this more research lab based assay for them.
Well, that's a bummer. Is there anything then that
Yeah.
you can suggest for people to do or to take that if
Mhm,
they have microclots, that would help? If they don't have microclots, it won't hurt them.
mhm. Sure. So and this was actually kind of the opportunity that I saw that was very different than what I normally do, that I went ahead and decided to go that direction. So um interesting thing about my background, when I started out, my PhD is actually in natural product total synthesis. I started out my career when I moved into medicinal chemistry of using natural products as the starting point to try to discover new drugs. So I'm fairly well versed in natural products, even though we tend to not use them very much anymore for pharmaceutical drug discovery. When I went into the microclot literature, the scientists that have been working in that area have done really good work, and they actually took it to the logical conclusion. They did a small clinical study on a bunch of long COVID patients, and it was about 90 patients. They took the long COVID patients and they treated them with a pharmaceutical cocktail called triple anticoagulant therapy. And it's three pharmaceutical anticoagulants that you take at the same time. So it's pretty powerful stuff. But the study was really interesting for two reasons. One, in that study, they saw an 80% recovery rate from long COVID, which is pretty good, even for a small study. The second interesting thing was this was done by one of the labs in particular that can do this research lab based assay for microclots. And they looked at the microclots in the patients before and after. And all the long COVID patients before they started taking triple anticoagulant therapy had microclots. And then after the fact, they looked at them again. The ones that recovered, their microclots were gone. The ones that didn't recover still had microclots. So that to me, that's the kind of molecular level data that I really like that convinces me that, okay, you really know what's going on. So I said, well, great. I went to everybody I knew that had long COVID. I was like, why aren't you getting triple anticoagulant therapy? This works. And it turns out there's three kind of drawbacks or limitations with pharmaceutical triple anticoagulant therapy. Number one is you're taking three pharmaceutical anticoagulants together. They're powerful drugs. They're nothing to play around with. And because you're taking three of them together, there's a significant side effect of bleeding as a side effect risk. So that puts you into a different kind of situation where you've got that kind of side effect risk with a therapeutic cocktail. So the second thing was that two of the three drugs in there are prescription drugs. So you had to go to a physician to get it. And when patients would go to their doctor and say, hey, I think I have long COVID, I want triple anticoagulant therapy, the physicians were like, well, I don't know about that. And the physicians were, I think, understandably reluctant to prescribe it. There's not a ton of data on it. There's only a couple of studies. They're somewhat dangerous drugs. There's this side effect risk. So the physicians are like, so people couldn't get prescriptions for it. And then even if they could, one of the drugs in particular, apixaban, is very expensive and insurance won't always cover it, especially for using it for long COVID. So that's kind of three significant issues. So there's a safety issue, there's an access issue, and then there's a cost issue. So I looked at this and I said, well, what people really need is a safe, available, right, over the counter, an affordable version of triple anticoagulant therapy. And having a natural products background, I said, well, we used to take natural products and discover drugs for them. Can I do the opposite? Can I reverse the process? And what I did was I sat down and I reverse engineered pharmaceutical triple anticoagulant therapy into a natural version of that. So, to do that, I use what we call the mechanism of action of each of the pharmaceutical drugs. We know what the molecular target is. We know what the mechanism is. So I said, okay, here's the three anticoagulant drugs. What are the mechanisms of action? Now let me go find a natural ingredient that has the same mechanism of action, the same target. And I formulated that together into an over-the-counter product to help people be able to recover from long COVID.
Which is awesome. And I love that you're scientific yet practical at the same time. So, what's in this?
So it's got turmeric in it.
Okay.
So the curcumin in turmeric is a factor 10A inhibitor, which is the mechanism of action of apixaban. It's got willow bark extract, which is a COX-1 and 2 inhibitor. It's the same thing as basically aspirin. It's a replacement for aspirin as a pharmaceutical. And then it has a component from traditional Chinese medicine called danshen extract. And danshen happens to have a couple natural products in it that act as P2Y1 and P2Y12 receptor antagonists, which are those particular types of inhibitors have antiplatelet activity and antiplatelet activation activity. They're a replacement for clopidogrel in triple anticoagulant therapy. So, and the important thing with triple anticoagulant therapy isn't any one of the specific three anticoagulants, it's taking them together. It's having this combination of three mechanisms of action that is likely what makes triple anticoagulant therapy, whether it's pharmaceutical or the natural version, effective for long COVID. Because it's known in the literature, if you try using aspirin alone, or if you try using an anticoagulant like apixaban alone for long COVID, it doesn't work. You need this combination of mechanisms in order to work. And with the pharmaceutical version of triple anticoagulant therapy, it's that combination that kind of makes it a little dangerous, the safety risk, a little bit reluctant. So translating that into a natural formulation that people can take and is really very safe. Even if you don't have long COVID and even if you didn't have microclots and you take my product, which I call CircuGuard, you're fine. Actually, I've had a couple of people take it and that weren't really sick with long COVID, they're like, I feel a lot better after I take that because it also has anti-inflammatory and antioxidant activity. And that's the when I first got it made, I took the first bottle. I did my own little trial just to make sure it was safe, make sure people wouldn't react to it, that it was a safe combination to take. And it really is. They're really high quality ingredients that people take every day for other things. What I did was I put them together correctly into a formula that really helps address long COVID.
which is awesome. So, how long would you suggest somebody take something like this
Mhm.
and hopefully they would start to feel better?
Yep. So what I typically tell people for the natural version is be prepared to take it for kind of 3 to 6 months. And here's how I came up with that number. In the trial they did with the 90 patients with the pharmaceutical triple anticoagulant therapy, they stratified the patients into two groups. It was kind of mild long COVID and then severe long COVID. The mild group they had on pharmaceutical triple anticoagulant therapy for 2 to 4 months. The severe group they had on pharmaceutical triple anticoagulant therapy for 4 to 6 months. So understanding for an average patient, right? Understanding that the natural version is going to be less potent. That's why it's safer, right? Is that the ingredients are not quite as potent. I think a 3 to 6 month window to really see dramatic improvement is what I typically tell people. But I the people that in my audience that have bought it and take it, a lot of them they start taking it and they see it results immediately. Their fatigue gets better immediately, or their brain fog gets better immediately to the point they really notice it and say, wow, I didn't realize it was this bad. And I've noticed it now that it's improved, right? So it really is something that is helping people regain some function in daily life, which was really my goal. Because, like I said, we're 10 to 15 years from true pharmaceutical therapeutics designed specifically for long COVID. And without products like this, there's not much else around to help people with long COVID.
Well, what about people with bleeding disorders? Do you
Mhm.
potentially say that might be a concern and you might not want to do that?
Yeah, so basically it's kind of the same rules of thumb for anticoagulants. So I tell people if you're on an anticoagulant, don't start taking this, right? Because it's adding more anticoagulant fuel to that fire. But if you're already on an anticoagulant, it's probably not the best thing to take. If you are having issues or are kind of indicated to not be on anticoagulants, it's probably not a good thing. So none of the amounts of any specific ingredient are super high in this because it's this combination that matters more than the amounts. But even when you have like if you go in for a normal surgery, if you look at the paperwork they'll give you, they'll tell you to stop taking turmeric before you go have surgery because of bleeding risk. So it's kind of the same rules of thumb as you see in other situations for anticoagulants.
What about a certain age? Too old, too young? Is there a certain period?
Um, so too old, no. I have no qualms about telling people that are older to take it, mainly because there's no age guidelines that I know of for adults for any of the individual components, and they're all very safe and are taken at much higher doses in other settings by people. So in terms of age, I kind of tell people I try to be careful talking about people giving it to kids, right? It's not really designed for kids. It's not really tested for kids. Um, you know, do I tell people no, it's absolutely not safe for kids? I think that might be going a little far, but there is a known restriction of giving kids white willow bark extract. So that's the main one to be careful with if your child is in that group, and I forget what the age cutoff is for under that age, you're not supposed to use that product in kids. Other than that, though, it's one of those, I think it's a judgment call. Um, Again, I wouldn't say it's unsafe. You absolutely, if you give it to them, bad things will happen. It's not one of those, but at the same time, it's, well, we don't know, so the safe thing to do is to probably not. But I understand people making their own decisions. And one of the reasons I kind of developed this product was to let people have an option to make choices for themselves and have something to try and take to help themselves and not be reliant on their doctor. So
Yeah, which kind of brings me to one of my last questions, which is if someone wants to try this and wants to talk to a doctor about it, do
mhm.
you find that there's a certain community that understands this, knows about it, is willing to talk about some of the benefits of some of these supplements on treatment for long COVID?
I think in general, the integrative medicine, functional medicine doctors are going to be way more interested and open to all of these conversations, right? Because again, they're interested in how and why and not just treating symptoms. And again, trying to think in an unbiased way. If I were a physician, somebody brought this to me, I would look at it and be like, well, there's not really anything bad in here for you, right? It's safe. Is it going to help you? I don't know. I can't tell you that, but um again, I think the functional medicine physicians are more open to saying, "Hey, let's give it a try and see if it helps." And there's definitely good things in here. Turmeric is good for you, right? We know that. Um, White willow bark is not bad for you, right? It we know it's an anti-inflammatory. It has antioxidant properties. So same for Dan Shen. So it's one of those situations where I think it depends how open the physician is. If they're a typical Western medicine doctor that only believes in pharmaceuticals and thinks supplements are like a grift and don't really have medicinal value, then that's going to be the type of answer you get.
And for those that are listening, you know, a lot of symptoms are born and made worse through inflammation and the inability of the body to properly detox. And so when we're talking about antioxidants, you're really helping the body pull some of the stuff out that really shouldn't be there. So um,
Yep, and overall, that's really what triple anticoagulant therapy is doing. So microclots are these kind of foreign bodies that shouldn't have formed, right? They're unnatural. What triple anticoagulant therapy is actually doing is it is reducing the formation of new microclots and helping the body naturally clear and get rid of the unnatural microclots that are present to help you recover. It's like the body just needs that support to be able to heal itself.
and then I'll digress for a minute with your work in oncology. Is there anything in particular that anybody listening might want to keep in mind?
Oh, I work in the very early stages of mechanisms and new drugs and new targets. So I mainly work on kinase inhibitors, and in that area, and there's a lot of good clinical progress. And what I would say is one of the things that made me angry about long COVID is oncology research is very sophisticated now. We do all kinds of very sophisticated experiments and ask questions and come up with very sophisticated ways to answer them. And the emphasis in oncology is now on speed and relevance to the patient, right? We're pushing more towards personalized medicine. We want genetic backgrounds on people's tumors to understand exactly which therapies are going to work and which don't. I was in that mindset when I went to go look in long COVID. And I think one of the reasons that I got mad was that mindset doesn't exist at all when looking at long COVID. And there's no reason that it shouldn't. It's just we're treating long COVID. We're kind of doing things at the usual normal speed of slow. And I still don't understand why. I really don't.
Yeah, well, my hope is that things start to speed up in a number of different areas when it comes to a lot of these chronic symptoms that everyone's experiencing. Is there anything else that you want to share? I really, really appreciate everything you've shared today.
Sure. So if people want to know more about this, One of the things that I really felt strongly about as I was doing this was, as I investigated microclot hypothesis, as I really put all the information together, I said, okay, now what are we going to do about it? Let's design something that people can take. I wanted that information to be in a place and in a format where people could really look at it themselves and review it and digest it and see whether they believed it or not. So all that work I did a lot of written articles on Substack. And all the research is there, reference to the literature. And then I also made videos, and those are on TikTok and on YouTube. So if people go to my website, it's keithcellisphd.com. There's links to the Substack. You can go read about all this, and there's pictures of microclots from the fluorescence microscopy. If you're interested in really seeing what those look like, those are in the Substack articles. So there's links to the Substack. There's link to all my social media, and then there's also a link to my product CircuGuard if people want to get it and try it for themselves.
That's wonderful. Thank you so much, doctor.
Thank you.